Good morning to our next Coffee With interview. This morning I'm interviewing David Towl, the General Manager of Health Promotion at Access Health and Community. Good morning, David.
Hello, how you going?
I'm good. I've worked with you for a long time and I don't think we've ever had a coffee with chat, so I'm looking forward to talking to you today and introducing you to a number of our partners who probably mostly already know you, but they'll find out a little bit more about what you do today. Before we begin, I will acknowledge the traditional owners of the land on which we meet and pay my respects to their elders, past, present and emerging. Tell me what Aboriginal land you're sitting on today.
I'm in the northeast of Melbourne on Wurundjeri land.
Excellent. So David, describe briefly Access Health and Community and the work that you're doing.
So Access Health and Community is a community health service at its core. This is our 151st year, so we're Australia's oldest community health service. We started as a paupers health service on Church Street in Richmond, where our head office is still based. And the foundations of that was there were a number of slums in Richmond, and people couldn't. This was pre-Medicare, long before people could access free for service health services, and a group of community members, particularly the churches, got together and approached some of the local doctors, and they said, if we provide you with a venue, will you volunteer your time to treat people there? And so they found an old pub and they did it up, and they turned it into a health service. And the pub isn't there anymore, but we still have a site there today. And Access Health and Community has gone through a number of names and a number of changes across that period of time. We've now got, I think, 16 sites across the east of Melbourne. Most recently opening some sites in more sort of the outer east and Ringwood, but we have most of our sites within the cities of Yarra, Boroondara and Manningham. We provide all of your normal community health services, along with a fairly large GP practice still, and a pretty big component of mental health and AOD treatment services. We've got a really interesting community arm which involves emergency relief programs, care respite, neighbourhood houses, men's sheds, a small childcare centre. And my role is heading up prevention in the organisation. I lead an awesome team of health promoters and community engagement staff, and we work with community groups, organisations, and internally in the organisation to try and help them be more preventative in their work. Since about January though, my role has been seconded to work almost entirely on the response to COVID within the organisation, and then more recently on a project externally facing, looking at coronavirus within high-risk accommodation facilities in the east of Melbourne.
Wow, well, a fascinating history to start with, and good for you. It's an amazing opportunity for you to be doing different stuff there.
Yeah, it's good.
So thinking about your usual role in health promotion and prevention, what excites and motivates you about that work?
So I started out in health as a paramedic. And when I was in New Zealand, the ambulance service in New Zealand is a bit like the CFA over here, and so you have volunteer and paid staff, and particularly in rural and regional areas, you have fairly high proportions of volunteers leading emergency ambulance services. So I started out as a 16, 17-year-old sitting in English class and a pager going off on my hip and leaping up and running off to a car accident.
How exciting.
Yes, and then through university and in my, I worked as a volunteer in the ambulance service and did some casual work as well. And it became pretty apparent to me that I wasn't fixing anything. I was literally the ambulance at the bottom of the cliff. And more and more, I found that difficult to get professional and personal satisfaction from. And I moved into prevention. I studied public health and I moved into prevention, I think because of that, because I wanted to stop people being unwell. And so what motivates me in that space now is that when I was a paramedic, if someone wasn't breathing particularly well, I had a bag of drugs that I could give them, and a suite of other interventions. And, you know, probably on the most part, they would be feeling a heck of a lot better by the time I got them to hospital. And in some situations, you could have someone that was unconscious and not breathing, and by the time you left them, they were sitting upright and talking to you. And that really instant feedback is amazing. But I find the benefit and the feedback of working with an organisation or an individual or a professional over a 6, 9, 12-month period, shifting them from being in a position where they don't see a need to change or a willingness to have an impact on the health of others, and seeing that shift in people where they suddenly start talking your language, that's so much more satisfying than the instant feedback of just giving someone a drug.
Yeah, the long term. And now we're all working from home at the moment. Have you got any strategies that you could share about your working from home life that have helped?
So I'm lucky in that I work half of the time in the office. Okay. So I work 1 week in the office in a site management capacity. That has its benefits because it means that I can go and get coffee, and I can see different 4 walls. But I'm also, it has the downside to the fact that I have to do site management, which is nowhere near as fun. So being at home, I have a fair bit of kind of gym and training equipment, and that routine I have found very helpful. It's continuing as much as possible with training and working out and keeping that within my my kind of program. I also think that you need to embrace the fact that you are in your home, and it is firstly and primarily your home and secondarily your office. Yeah. So if you do not, I am wearing pants, but if you do not want to wear pants that day, then that's your choice because it's your house. If your child or your dog or your whatever wants to join your meeting, that's more important. And I think that employers need to recognise that we have invited ourselves into our employees' homes, and therefore that comes first.
Thank you. I'm so pleased that you're wearing pants today.
I am wearing big fluffy socks though.
Me too. Can you describe some of the key work that has had to dramatically pivot during the pandemic and how you've managed that? And that can be about your health promotion work, or you could talk a bit about the work that you've had to, or how the whole organisation has pivoted. It's up to you.
Look, I think it was a really interesting day when we decided that staff needed to start working from home, and saying goodbye to my team and not knowing when I would see them again, like physically see them again, and not knowing what we were going into. So at that time, people were leaving, and we were seeing stories from America where the country was being decimated, as it still is, and quite frankly, was the next time that I saw these people, would it be at a funeral or something like that? It was, you know, it was really quite emotive. And we very quickly had to pivot to talking to each other via, you would never use Zoom if you didn't have to. You would never use Microsoft Teams if you didn't have to. And we just had to get used to that as a health promotion team. And the team, with me being seconded in their own stead, they've established morning kind of huddle meetings and kept everything. They've increased the frequency of team meetings so that people are across things. We had programs working with sporting clubs where we were running workshops face-to-face for them and then developing action plans with them face-to-face. We had to pivot and run all of them via online webinars. In the same respect, we run gender equity training for early years centres, and we had to very quickly pivot to change that. From an organisational point of view, we had to very quickly change the way in which clinical interactions happen so that people could continue to receive high quality care. And we had to make some pretty clear judgments about there are still some things that you physically have to be seen by a health professional for, and that's your risk, or if you've got a rash, a GP needs to see the rash. They can't diagnose things over the phone without seeing. And so we had to put a lot of those processes in place, but at the same time, we had to protect our staff because we didn't know what we were up against, and we had to protect other people in the community. We found really early on that people weren't being truthful with when we were asking them questions about their risk factors for COVID-19, and they weren't taking risk screens really seriously. And so we had to quickly pivot that kind of messaging where we were saying, no, stop, don't, please, can't, you mustn't kind of language. And we pivoted that to be much more kind of values-based messaging, talking to people about it's really important that you, and for the health and safety of everyone, please, and thank you for your help to shift people into that more benevolent kind of mindset. It's been, the other thing I would say is that it has demonstrated our need as an organisation to communicate better internally and clearer and better with our community and with our clients. So making sure that all of our communications are health literate, translating them almost entirely into our 6 community languages, making them available through a range of formats so that people can access them easily. It's those sorts of benefits that the pivoting has allowed for, because you haven't had to go through the long working group process, because it just needed to happen.
It just had to happen. Yeah. What have you learned from this fast adaptation, or I suppose those things that you've just talked about? How do you feel that's going to transform Access Health and Community into the future?
I think it will improve the way that we work internally, and it's made us a lot more aware of our community partners and organisations. I think we were aware and engaged with our partners, but I think it's made us kind of more aware of the importance of community partners. I think also COVID has shown us that if you are financially or socially disadvantaged, if you are culturally and linguistically diverse, if you are female, you bear a greater burden of health and disease. And it's started a lot more of those conversations, and it's been easier because it's given us a tangible to have those conversations with people. Yeah. And I really hope that sort of stuff will carry on.
Me too. Do you have any reflections on the nature of recovery and resilience and how that might inform decisions made about the future for your organisation?
I'm less nervous about community health, primary care, health in general. I think actually quality improvement processes and things that health services use generally mean that the lessons that we have from something like coronavirus will translate into the future. So I know that we'll probably have a pretty good stockpile of masks in the organisation now. I'm pretty confident that we'll maintain that stockpile. I'm also pretty confident that by being able to rapidly pivot to translating resources, we've shown that we get better buy-in from people. It's easier for our staff. And so it's not hard to continue doing that in the future. Yeah. I'm worried that there'll be a political position that says we've spent a lot on health and on marginalised communities in 2020, and maybe they've had enough. So I think we have to keep the pressure on that to stop us being in a situation moving forward that might mean that, you know, we can't follow those lessons.
Yeah. Let's get back to talking about isolation at home and in your workplace. Is there anything you're secretly enjoying about that?
I like the 22-minute commute as opposed to the 40-odd minute commute on the weeks that I'm working. I actually quite like training on my own in my garage because people who know me and who've gone to the gym with me will know that I complain about everyone else at the gym and their conduct. And I don't have those people because it's just me and I'm the best person. I'm the best behaved individual at the gym.
You know what the rules are there.
Absolutely, and they're my rules. I am enjoying the fact that every Friday I get on a Zoom call with a group of my best mates and we make a point of it. And even people who are in other states and overseas are still joining those calls because they're recognising that some of us are needing to have that contact. So that is probably more frequent contact than I would have with people when we weren't in lockdown. That's not to say that I haven't physically seen my best mate for 6 months, and I would really like to do that really soon. But I'm valuing the opportunity to just sit and chat with people every Friday night.
Yeah, that's great. How is your organisation addressing climate change and the effect that this will have communities that you're providing services for?
So internally, we have a staff working group committee called Happy, Healthy, Green. And that's a committee that looks at staff health and wellbeing, environmental sustainability, social activities and things like that. And we have probably, the thing that we've probably struggled with most is around environmental sustainability, because it's, even in an organisation of our kind of medium size, we don't have a dedicated resource for sustainability like a large health service might. And that means that there's a lot of really well-meaning people trying to fit in sustainability projects around falls assessments and cutting toenails and health promotion programs and whatever else is going on. So something that we've done this year, and in retrospect, it would have been great if it didn't happen during a pandemic, but we're working with RMIT University and a group of 9 postgraduate students who are developing us an environmental management plan for the organisation. So they're doing baseline assessments of waste, water, and energy for our organisation, and looking at what our impact is and what are our opportunities. And that will be really valuable because it gives us a case and some measures to pitch ourselves against. We're also connected to a fantastic organisation called City Switch, who are a federally funded organisation that's led by all of the Lord Mayors around Australia. And they support, so they're based out of the city of Melbourne, and they support organisations to be more environmentally responsible. Mm-hmm. And they particularly work with organisations who have properties and tenancies. So if you're in a tenancy within a body corporate, it's really hard to make impacts in your environmental sustainability, and they help you in ways that you can do that. And their help's been really invaluable. So I would recommend anyone who was interested to get in contact with them.
City Switch.
City Switch, yep, they are awesome. So what will that look like for us? I think it will look like us changing our procurement practices. I think it will look like us putting in energy sort of conservation practices in place, looking at the ways in which we sort waste, and I hope that the impact that will have on the community, I hope it will be positive. I hope that it's something that will be meaningful for people, that they can see that a health service that they are attending is considering the environment as well. I think it's important for us to start having some messaging for people around the impact of climate change. I saw something yesterday, and I think it was in Times Square. There's a clock that's been mounted, and it says how many years until we're at an irreversible tipping point for the damage to the Earth's resources, and it's 7 years away. I think we're in an interesting position with a new state public health and wellbeing plan that lists climate change, and I'm interested to hear how the department believes that the funded prevention sector can address that. I think it's important for us to consider climate in any of our work and to try and be mindful. I'm not sure that we have the span of control or the resource to have much significant impact. And certainly anything that we did would have to be prevention at scale and joined up across all funded prevention agencies to see any difference.
Yeah.
I think it's also worth noting that there's a national preventive health strategy, and that document makes no mention of climate change. And so we have a disconnect in place between state and national.
Yeah.
And that's not a good thing.
No, a bit concerning. David, my final question for today, what are you looking forward to when our time of isolation is over? I can only assume that is getting back together with your team in health promotion.
Look, I think that will be nice. We, as permitted workers, we've had some opportunities to, I don't think we've all been together, but some opportunity to see each other as individuals for different reasons, and that's been really lovely. I think I would just like to not have to think whether I'm allowed to do something or not. So I don't know. I'm sure I'd like to go for a holiday at a beach for a long weekend, or I would like to get a haircut. I would like to be able to go and get a massage again. These kind of things are some of the things that I would like. Interestingly, I've got no real desire to go out for brunch. I haven't missed that. But just the, oh, I need to go, oh, no, I'm not allowed. I'm waiting for the time when I don't have to consider whether I'm allowed to do things or not.
Yeah, me too. David, thank you so much for your time this morning. It's been fascinating having this chat with you, and lovely to share all your thoughts with the partnership, and looking forward to seeing you again soon in person.
Cheers.
Thanks, David.